And now I'm going to hand it over to Michelle Domey, who is the parent of an adolescent patient at Boston Children's, to share her experience.
Thank you, Erin. So our journey at Children's actually started when my son was born in 2004. We were seen in orthopedics for hip dysplasia and torticollis. So back then, everything was done on paper. The portal wasn't quite up to par where it was today. And a lot of what we did, he was in a lot of different hip apparatuses. We did a lot of early intervention therapies, and everything that we did was on paper. So either the doctor gave us paper or I took notes and I brought that, and that was our main form of communication at that time. We were seen through till 2010, in which we got a clean bill of health, and we thought we would never look back. About 6 months later, we were surprised to find ourselves back at Children's with some unexplained facial swelling that Carson had developed. By this time in 2010, we now had cell phones with cameras on them. So I became an early adapter to technology and started taking photographs of these mysterious swellings that came on Carson's face and started documenting them, storing them, emailing them, keeping files for that. So technology's always been in our realm. In 2011, Carson was diagnosed with oral facial granulomatosis, a rare form of Crohn's disease that affects the mouth in the absence of the intestines. And through that, we were able to get more of a quick diagnosis because of the technology that we were using with the pictures. In 2015, Carson was actually diagnosed with Crohn's disease in his intestines. And that's actually when our first clinical note was available. Today, fast forward, we have a lot of clinical notes. We use technology and the clinical notes on a very consistent basis. So the picture that you see on the left was probably one of our most challenging appointments. It's one that we haven't shared a lot, but Carson did give us permission. That's actually how, as a parent, a lot of our appointments feel. It's emotional, it's stressful, and as a parent, you're not able to retain a lot of the information that's given to you at that time. So making decisions and being able to have a note at the end to go back to has been a huge help. It's improved our communication with our clinicians. It's definitely made us more compliant to medication adherences and our care plans. When I look at all of, can you go back? Thanks. When I look at the notes that are many in the portal right now, it paints a picture. It's pieces of a puzzle that I think paint a picture of Carson's journey, his medical journey from 2015 through now. Just from January, we've had a tough medical spot the past couple of months, and from January 31st through July 16th, he's had 9 appointments that pull up in the portal. So 9 clinical notes that pull up. And it looks like a lot. And it looks like those pieces of the puzzle, when you put together, could make up the full picture. But it's actually not. There's 11 notes that are missing. And ironically, 10 of those are from adolescent med, and 1 are from infectious disease. So that is a challenge. I understand, as Fabian said, that there's some, privacy matters and high risk, but it doesn't actually give you that full picture when you go back and look at it. So I always joke around, my initials are MD, but I'm not a doctor. When we look at the clinical notes, some of the challenges is that the language is written from a doctor to another doctor. I actually look at that as a plus. It's actually made me more educated. I've looked up some of the words that I don't know. I've learned a little bit more, and I've asked questions to our clinicians as far as, what does this mean? Is there something that I'm missing? There's also, when you look at that whole picture and put those pieces of the puzzle together and you have them all, you can also see that one of the challenges is that some loops aren't closed. So one clinician could say that, they're going to follow up with another one, and then another one's going to follow up, and that's not closed. So that sometimes to a parent looking at it is like, well, who's running the show? A lot of times we find copy and paste things, and that can happen. We know that doctors are busy. And another challenge that I think, not so much for myself, but some other families, could be around languages and literacy. So at Children's Hospital, like Spanish and Arabic are one of the languages and top languages, and I feel that that could be some of the challenges as well. A lot of the opportunities that I think in the future is, I know that the Open Notes website can provide tons of information for parents trying to navigate or patients trying to navigate exactly what are the notes, what's contained into them, what am I missing. In the future, I think telemedicine, as that expands, that having a note set up for that would be great. And also pretty much to the topic of a loop not being closed, if there was a way to flag some information to remind a patient, as far as if there's follow-up in 3 months, maybe somewhere down the road, to have technology to push those reminders through a portal to a patient to actually follow up on that. And I think the biggest opportunity that Open Notes has is that a couple of our clinicians have put in personal notes about Carson as far as what his interests are and what his passions are as him as a person, not just his disease. And that's really helped create some strong bonds between new clinicians or residents that come in and see him, and that they walk through the door and already know a piece about him. I think the strong relationships that we have with our clinicians can provide better care. The transparency is there, and I think that the trust is definitely the reward between the patient and the provider. Thank you.